screen okay?
Yes.
Yes? Okay, wonderful. All right, so thank you again for joining us for this community discussion around Mpox, where we are, and hopefully by the end of this session, you will walk away with a number of different information on Mpox. Now, excuse me. I'd like to start with this quote by Audre Lorde, and because this is a community panel, this quote truly resonates with me, partly because of a lot of the issues that are going on now in our country, especially around at the federal level and how it's affecting communities on the local level. And then on top of that, it's compounded by other disease processes that of disproportionate effects the LGBTQ plus community. And so Audre Lorde starts out by saying there's no such thing as a single issue struggle because we do not live single issue lives. Our struggles are particular, but we are not alone. What we must do is to commit ourselves to some future that can include each other and to work toward that future with the particular strength of our individual identities. And so since Mpox started, and all of this started when in 2002, when Mpox was affected us here in the US and around the world. But since 2024 to present, nearly 36,000 Mpox cases and more than 100 deaths have been reported in the Democratic Republic of the Congo and several other neighboring countries in Central and Eastern Africa. There have also been cases reported in Africa, outside of those areas, in Australia, in Europe, Asia, and South America. And a lot of those cases that have been reported outside of that two areas, or three areas rather, have been travel-associated Mpox. And so what does that mean? So since 2025, so this year, there have been a small number of Clade 1 Mpox cases that have been confirmed here in the United States. So roughly about five, one in California, one in Georgia, one in New Hampshire, in New York, and in Massachusetts. Now, please note that the Clade 2, though there's Clade 1, this is the one that's current. Clade 2 was the one that started the global outbreak in 2022. And so with Clade 1, now as we know, it's these travel associated. So folks who have left, traveled abroad to these endemic areas and then come back to the US reporting symptoms of Mpox. Mpox is still affecting gay, bisexual, and other men who have sex with multiple partners. Now, I wanted to take a moment and just to talk about the research that we did here in our center, and to talk about what some of the findings that we found from the research. Here's our research team, which is made up of a number of different folks that represent our community. This is the paper that we actually published from the Mpox research that we have done. And that quote actually came from a study participant here in California who expressed the weaponization of Mpox when it first started in 2022 and how this was going to be a target on the LGBTQ community. And again, keep in mind what was going on in 2022 as well. So keep in mind that compounding effect of COVID and Mpox. Yeah. Now, we know that from the research, Black and Latino sexual minority men have been disproportionately impacted by Mpox in the US. And when compared to their white counterparts, Black and Latino sexual minority men had the highest prevalence of Mpox and the lowest rates of vaccine uptake. Now, despite the recognition of social determinants of health as drivers for this disparity, such considerations were frequently omitted from informational and vaccine campaigns. So what we found was absent from the literature was this examination of this perspectives of Black and Latino sexual minority men on the actual Mpox disease, social stigma, and in the inequitable rollout of the vaccines. And of course, we couldn't look at that without not factor in the role of medical mistrust in that whole process. So we embarked on this quest to understand those factors, looking at Mpox-related sexual behaviors, harm reduction strategies, vaccine barriers and facilitators among participants living both here in California and in New York at the time, two places that saw extremely high Mpox outbreak. Now, in we approach it with these two research questions in mind, trying to understand what are those harm reduction strategies, vaccination experiences, and then were there any barriers and facilitators to obtaining vaccination for these two communities. So we had about 41 participants that participated, 20 in California, 21 in New York. We use a qualitative interpretive phenological research design, utilizing thematic analysis to identify themes through a collaborative coding process with all members of our research team. We had a very diverse sample, anywhere between folks who identify as gay or genderqueer. Now, this shows you the process of how we went from how we coded the data, how we categorized the data, which is in the middle, and the four themes that emerge as a result of our analysis. So the first theme that emerged from the analysis was the social and sexual behaviors curtailed by the Mpox outbreak. And so in looking through the first theme during the Mpox outbreak, and this was going back to 2022 at the time when we did this work, a lot of folks reported curtailing their dating practices during the outbreak. So, for example, this participant said, I do notice now looking back, people were definitely more reserved. And I was just kind of like, okay, well, I guess they're just reserved. Like, I didn't associate it with Mpox. But then some people were like, yeah, I'm going to be away from you because Mpox situation is scary. This other participant said, oh, honey, I don't want that. Lord Jesus, when that came out, I definitely stayed in the house. A third participant said, well, there was no romance or anything sexual as it got more serious because I was just like, again, I don't want another thing. I ain't even got the vaccines. I don't even know what's going on. Keep in mind, what's compounding this too as well is the very fact that some of these participants were old enough where they remember the era of the HIV/AIDS crisis, and they were mirroring or be somewhat re-traumatized, looking back at how Mpox emerged and what was going on. So then this other participant or participants talked about the harm reduction or risk reduction strategies that they employed. For one participant, it was around this committed celibacy. And so he talked about being in a committed celibacy during that time. And the reason why I got the Mpox vaccine, because I know you can contract it by touch and stuff like that. It was like the summertime. So being social, out and about, I knew even through though COVID's not over, I knew socially things would be more active and frequent during the summer versus previous. I just wanted to have the precautions. So keep in mind, this is at a time where folks will actually finally start to coming back out because we've gotten a handle on COVID, folks were getting vaccinated, and then boom, you get hit with a new disease process, Mpox. Yeah, I think I was abstinent for a month, I guess a month and a half before getting both of my shots. And then here comes this fear now. And so another part of this is the fear and concerns around Mpox. And so one participant said, well, the same way I did 20, 30 years ago when HIV came out, I'm avoiding people. And you can only get through my defenses if I know you first and foremost. No strangers, period. And I need to know some things about you. That's how you can get through my defenses. And you can't even get naked in my bed until I know what's going on with you medically. This other person said, well, that was a time when I decided not to go out. So it didn't have a big impact on me. And plus, because I had like two friends that got it, so I got scared. And we had like some patients that had it, even kids. I work in pediatrics, and we had some kids with Mpox. Another theme that emerged was this community stigma. And I'm hoping that we can get into some of this in the Q&A session later. But this one came up, for example. I feel like how it's been labeled. It reminded me of the AIDS crisis when it was first considered a gay illness. One of the reasons why I haven't taken the vaccine is because of the screening questions. I'm not going to lie, and I would never tell my patients to lie. When I found out my husband got the vaccine, I was like, oh, have you had multiple sexual partners in the last 2 weeks? which was a joke, of course, I hope. But two of the questions asked if you have had anonymous sex or multiple sex partners with 1 or 2 within 1 or 2 weeks. And I have not until the criteria has changed and everyone is included, regardless of whether they are having anonymous sex or promiscuous sex or not, then I'll take it. But for now, I'm not going to lie on those questions because just because I want it. It should not be. And then you're using those data to say, oh, these people are having multiple sex. You shouldn't force people to do what's wrong. And I'm a firm believer in that. So no, I have not taken the Mpox vaccine. So this person is actually speaking on the actual CDC criteria at the time for you to be eligible to get vaccinated. And so he's saying, I don't want to lie. I'm not going to lie just to be eligible for the vaccine. While on the other hand, a lot of patients did actually communicate that, yeah, I didn't tell the truth because I wanted the vaccine. Yeah. Now, in terms of that vaccine skepticism, it also shows up in the form of stigma too as well. And so this participant said, because the Mpox vaccine is new, it hasn't went through the trial and error yet. I just don't trust it. The other person then talked about the fact that it leaves a bubble, right? So it leaves a bubble. Now they've been doing the subdural. I think that's problematic for some people because it leaves a mark. It is, I think some people, we've heard that some people see it as when they get it. Some folks are saying like, okay, I've got my vaccination. It's proof that I've got my vaccination because I have this mark. There are others who find the mark to be unsightly and a permanent stigma. I'm sure you guys have heard of that before. So it developed like that keloid scar. Yeah, has that mark. And then the third theme that emerged from the data was the multi-level factors that were impacting the vaccine access and uptake. And the first one being barriers. And so this participant said, I couldn't sign up because the place or website crashed. There were so many people trying to sign up. So after several weeks of investigation about how the rollout of the Mpox vaccine was, it was discovered that, or the data revealed that white gay men were signing up disproportionately to other racial groups. And that even when the websites oh, sorry, when the vaccine sites were in communities where white gay men did not live, they were going up there to get the vaccine, where the vaccine was intended for people who lived in those communities. The second participant said, yeah, it was a systemic barrier. I don't know who came up with those criteria. Yeah, but I mean, I think you needed to have, I don't know, how many sex partners, sexual activity with someone who you believe was positive to Mpox. So yeah, those horrible criteria, that's kind of what I meant. And when I said unnecessary, whoever puts the number of partners, the medical staff will then say, what the heck? That's kind of what I meant. And then the other piece that showed up was around now this element of fatigue. And this one participant said, because I'm already taking HIV meds, so this is someone who's HIV positive or living with HIV. Now I got 2 vaccines. I don't want more stuff in my body. I feel it will do something to my immune system. I just don't trust it. So this person is living with HIV, have already gotten multiple COVID-19 series, and now is being told that you need this new thing, which is Mpox, and just not wanting more things in their body. Yeah. And of course, while there were some difficulties or barriers, there were some facilitators to effective uptake of the vaccine. And one example is from this participant. I mean, I've gotten vaccinated. I'm glad that my community members have been vocal and organizing around increasing our awareness and access to these resources and information. They have been a direct support to me in regards of me having gotten like updated and reminded me like, oh yeah, this shit is going on. And me looking to get my appointment set up and getting this shit taken care of. Yeah, I've gotten both of my Mpox, my first and second dose. And of course, this other participant spoke a little bit more on those risk reduction strategies again by saying, I think I was actually at one of my appointments and my provider was talking to me about really the uptick of Mpox cases that were coming into the community and that they were seeing people at my healthcare center. So whenever I get that kind of information, I try to respond accordingly. So there was definitely something that shifted. Any practices that we had as a couple or additional partners or whatever that we sort of said, you know what, we should make sure we're vaccinated first and then go from there. Now, what does this mean? Alterations to vaccine administration protocols and outreach efforts for reasons identified in this study are crucial to addressing the disproportionate impacts of these experiences in our communities. Culturally, public health messaging, especially around disease outbreak processes, risk, and vaccine eligibility criteria, make sure that those are appropriately tailored to communities disproportionately impacted by Mpox. And of course, more research is needed to look at some of these issues and to quantify the compounding interactions of infectious diseases, vaccine barriers and facilitators, vaccine fatigue, and vaccine skepticism. We should understand that this whole feeling around vaccine fatigue is real, where folks have been communicating since one person said, since COVID came on the scene, I've gotten more shots in the past 2 years than I've gotten in my entire lifetime. That says a lot in terms of that added burden on communities, and not to misconstrue vaccine fatigue with vaccine skepticism or vaccine mistrust. Yeah, and of course, medical personnel really must consider equitable frameworks that promote trust between communities of color and the healthcare system. Now, how do we achieve this? One, by addressing social and economic determinants of health, looking at financial and housing assistance, increasing access to medical insurance coverage, targeted outreach to communities of color, and you will hear more about some of the community outreach efforts from the different panelists. And of course, social behavioral approaches like the stages of vaccine readiness and action, where we tailor vaccine specific messages that are individually tailored for the patient or the participant sitting in front of you. And of course, I want to make the point by saying these three things are not the same. Equity, equality, and justice. And what we should strive for as people who work in communities and who provide care to communities is this justice equity framework, where we remove all barriers that would impede uptake of vaccines within communities. And then to round it out, doubt and skepticism about science, research institutions, and government are not easily overcome. Persistent racial bias, discrimination, and the dearth of BIPOC clinicians in the healthcare system is well documented. And so building trusted relationships between patients and providers requires actively listening to other stories and ensuring that barriers and challenges are addressed. Now, I want to just to stop here and stop my sharing and then bring back in for my next panelist. And I realized that I jumped straight into my presentation without actually introducing myself. My name is Dr. Orlando Harris. I'm an associate professor of nursing and medicine here at the University of California, San Francisco. And my research focused on vaccines, on violence, and mental health, and poor mental health rather, and how those intersecting factors impact in our community. Now, I would next like to invite my colleague, Andy. Andy was born in Mexico during the Aquarius season. They studied sustainability and city planning at the University of California at Berkeley. As an interdisciplinary major, they learned about the lack of resources locally for BIPOC, LGBT plus communities, and have worked since then to ensure equitable access to HIV prevention and care services. I'll now turn the floor over to Andy.
Hi, everyone. Thank you, Orlando, for the introduction. Thanks, everyone, for being here. Yes, my name is Andy. I use they, them pronouns or just my name, although we're not going to interact with one another, but I want to make sure that there's visibility for those who identify as trans, non-binary. So again, they, them is fine, or Andy's okay as well. As Orlando said, I'm the clinic operations manager at the Glenborough Wellness Clinic. And this clinic is a part of a project of the Oakland LGBT Center. But I'll give you more information about our implementation, what we did to make sure our clients and also overall community was able to access some of those doses we discussed also with Orlando. Chuk, would you mind going next? Thank you. Here's a photograph or our brief and small team. We are small by mighty. We're 5 of us, actually. We just recently lost one of our team members due to staffing issues. And as a lot of organizations across the nation, issues with funding. So on the picture, you will see our provider, Tim, to your left. He actually works for Lifelong Medical Care, but he's contracted with us to perform sexual health services, educate our community around vaccines, educate our community around HIV, and also just making sure people access treatment and care. Patrice is our phlebotomist, newest member of the team. She wasn't at the time of Mpox, but currently she's focusing on the new injectable for PrEP. Maurice Tobin, who a lot of you probably already are familiar with him. He's our Director of Prevention Services, holding some great bouquet. Behind him is Dante Washington, who is our HIV linkage care. Unfortunately, our clinic, we don't do primary care or HIV care. We just link people into different organizations and clinics that can support them based on their insurance or not having one. Lulu, who was there to support us doing administrative work and scheduling people for those vaccines, is at the back. Me at front on blue. And right to your right is Benjamin Jackson, who is our new Director of Prevention Services at our new location in East Oakland. But yeah, just a brief agenda here. Like I said, I will introduce our clinic. I'll talk about some key elements of implementation, some of the things that Orlando already touched about, barriers around access and what we heard from our community, the advocacy work we did to make sure that we had vaccines accessible, our numbers, what worked, what didn't, and a brief conclusion. And then at the end, I'll have time to answer some of your questions. Next, please. Great. So I couldn't talk about our clinic without really talking about icon Glenn Burke. Glenn Burke was actually a Oakland native, Black man, first openly gay MLB player in the major leagues for the Aids and also the Dodgers. He was iconic because of the way that he demonstrated himself in the field, but also with his teammates. He was actually outed by his teammates. And of course, discrimination did happen while he was playing in these two major leagues, but he didn't really back down. He continued to be himself. And so we thought that it would be great to name our clinic after him with the blessing of his family. We actually just recently met his niece, and she always has great stories about Glenn Burke. So the clinic opened in 2021, and we've been offering services for 4 years, all around, like I said, combating HIV, supporting folks accessing HIV care, and all other sexual health preventative services. And like I mentioned, we are in partnership with Lifelong Medical Care. With the support of our provider, Tim, we're able to educate our community about all needs regarding sexual health. And overall, just making a friendly environment so that the clients that stop by at our clinic don't feel judged by, the questions they may ask, but their sexual behaviors, or if they come up with a treatment based on their testing. We try to do our best to make sure people are seen by who they are. Next, please. So great, another quote here, actually, Glenn Burke, and you can click next again, Juke. Glenn Burke mentioned this in one of his books. They can't even say that a gay man can play in the majors because I am a gay man and I did it. Fun fact about Glenn Burke is that he invented the high five. So every time you do a high five, this is Glenn Burke's legacy as well. Next, please. Like Orlando and all of us know, Mpox is not over. And so I wanted to highlight some key elements of implementation and also walk you through some of the things we try to do in order for our community overall to be able to access it through our clinic. Next, please. So as we know, the CDC in 2021 announced the first case of Mpox in the US from a local resident who, recently had traveled to Africa. Around early 2022, we heard that the vaccines were gonna come over to the Bay Area. There was a lot of misinformation, of course. There was a lot of questions around implementation and also where are they? So we then learned that the city and county of San Francisco had access to them, and also the city of Berkeley to Steamworks Bathhouse, which of course, these two cities, predominantly white, predominantly more affluent, predominantly more young, were able to access these vaccines sooner than other places in the Bay Area, which included cities like Oakland. This, of course, created barriers around accessibility of this vaccine. because, you know, people were trying, like Orlando said, travel to San Francisco, travel to Berkeley to find out that the media was actually present. And that's another thing that happened during the first wave of Mpox. The media outlets started to visit these bathhouses, doing interviews to people, filming people without their consents, and again, using very derogatory terms and language around this being a gay disease. Sounds familiar? We know this also happened when HIV happened in the 70s, and so there was a lot of confusion out there. Next, please. So we heard from the people as we were trying to navigate what could we do as a clinic. We right away and then realized that there was barriers around accessibility, and they were mentioning that this vaccine was only for men who have sex with men. There was also considerations about what high risk meant. So a lot of people had questions around that. Language access, of course, as a Spanish speaker myself, I always advocate to making sure that people who do not speak English are able to access important information and actual information in their native tongue. There was also fear to be outed by the media. People didn't want to go to the bathhouse or anywhere near where the media will be because, of course, they will be filming without their consents. People were also wondering, is it going to cost? How much? Where do I go? How do I access them? I'm uninsured. And of course, as we touch bases, also medical mistrust, right? Another vaccine right after COVID was a lot for the community. Next, please. So what we did was advocacy. This is Joe Hawkins, our CEO and co-founder of the Oakland LGBT Community Center. He actually was like, we need vaccines like right now in Oakland. And so he essentially reached out to the Alameda County Public Health Department and make sure that, you know, he was heard and advocating because he already have heard that there was efforts in San Francisco, in Berkeley, and he said, hey, like we're literally down the street. How come we don't have vaccines? So he advocated to make sure that Mpox vaccine was accessible for all LGBTQ individuals. And beyond just LGBTQ individuals, later on I will touch bases on who actually showed up to get the vaccines as well, because not only LGBT community, of course, were brought into the picture, but everyone across the board. We saw couples, we saw hetero people, we saw cis people, we saw even cleaning people that were doing cleanings in the hotels. So across the board, everyone was able to access at least one dose through our clinic. We also thought that, hey, like, how are we gonna implement it? We only see clients 3 days a week, and we might not even have the time to do all this effort, but let's plan. So what we decided to do was pop-up clinics on our admin days, which are Tuesdays and Fridays. We also did pop-up clinics on Sundays during farmers market. And we also did mass clinics, and these mass clinics happened during major big events that we were also hosting and across the city. Next, please. You can click next as well. So now a big number, right? We actually were able to buy 3,052 plus doses for people in our clinic and also outdoors through our clinic. I say plus because there is a couple, maybe 100 or 200 more doses that we still have to confirm for Pride 2023. But I also heard, and not to give me kudos or the team, but I heard that we actually were one of the first, if not the first, clinic to actually offer the service for our community, and also more than Kaiser, but don't quote me here. Next, please. Some of our numbers, we actually didn't know, we had to start a whole schedule manually to make sure that we were organized, because we had hundreds and hundreds of inquiries, calls, online inquiries, questions. So we definitely were like, we need to come up with a plan. And so on the top graph that you see, you can start to notice when the major ask for vaccines happened, and this was in August 2022. We saw the most on our Tuesdays and Fridays clinics, 39, 40 people across our clinic showing up. We also see on the graph to your left that our Sunday mass clinics also had the most doses done. And the first weekend that we saw the most was also in August, with 300 to 500 in September after. So definitely there's a high need during those months. And also, as we were going down the year 2022 and ending the year, you know, people are traveling, ending of the year, people are still struggling to pay rent. So we also noticed a decrease on those doses for that time. Right below on the next graph, I broke down a little bit of our numbers, and this is mostly for 2022, 2023, when we got the urgency to make sure that we had access to folks. But we also realized that a team of 5 couldn't do everything. So this is where BayPLS supported us earlier in 2023 to start dedicating some of their nurse staff to come and help us do the doses. So that was great support. Next, please. One more time, next, please. And then, like I said, we try our best to go where our people were at, focusing specifically on major events we were already hosting. So one of them was Pride, Oakland Pride 2024, and then Rainbow Fair 2024, where we were able to administer 215 doses to our community. And not only that, we were also able to support them with a $50 gift card that the Alameda County was able to support us access. As we know, people really needed some resources, and we thought that a gift card would be easier to, you know, disperse, but also as a good incentive so people can actually show up. Another thing, for our events, we also partnered with La Clinica, which is a clinic here in Oakland that offers primary care HIV services to mostly Spanish-speaking community and also Mayan community in Fruitville district that's here in Oakland as well. We were able to partner with them to announce that we were offering the vaccines for free, and also that we were not asking for any documentation, including an ID, because that also created barriers for access. Unfortunately, we weren't able to host a clinic there because of their timing and also the urgency of getting these out, as they were also about to expire. Could you click next, please? So again, this definitely was a team effort, first from the Oakland LGBT Community Center doing the advocacy work, also with BayPLS supporting us with all the nurses, and of course with the Alameda County supporting and access multiple doses at different time periods to be able to spread them around. Next, please. So effective things that work and didn't work. Definitely, like I mentioned, we were not requiring an ID. And I know this could be problematic, but we were not requiring an ID. Tons of calls came in because undocumented individuals were having fear that if I didn't show up with an ID, therefore someone will call ICE, or I'll be in trouble, or I won't get access to it. So we were not requiring an ID. We just asked people to bring, like, if they had a paper that said their name, and to be sure to give us the right date of birth for them so that the county could update their records. We also had multiple staff members who help us do translations in Spanish to be able to inform the community around access, where and how it worked around our clinic, and doing the translations with the nurses. Some of the nurses were also Spanish speakers, so that was also helpful. And then lastly, the questionnaire, I think it came up already. We were not focused on the answers people were giving us. We generally were focusing on if you're asking for it, therefore you want it. So we were essentially eliminating the questionnaire. They were only asked some questions during the time that they will see a provider in case they needed another form of prevention. And then location, like I said, location was very important. So we try to go places where people will go, especially marginalized communities, including Black and Brown individuals. Next, please. And then conclusions, we still need a lot of work to do around accessibility, because what does that mean around people who can access it currently? Also, there's still confusion on when to do their second dose. So people are still confused. Did I already get the first, but I don't have the second, you know? Also, the vaccine went commercial, but there's still folks calling our phone lines, asking us for those who don't have insurance, where to go. Majority of folks in the county actually didn't receive the second dose. So again, full protection not being there. And then community members still fearful about ICE showing up to local clinics. And it's something that we've been talking with La Clinica as well on challenges that are beyond, you know, our local clinics, but we're trying to do efforts so that people can be seen and feel safe at our clinics. And again, staff challenges. We're only 5 people in our team. We wish to have more, but next, please. I did wanted to show real quick a flyer that came out of the work that we've been doing. Orlando Juke was supporting us creating this infographic with mostly all the info I just shared with you, but it's very friendly. There's also a copy in Spanish accessible to folks so that they can take home, read it, learn about it, and be able to see that, what worked, what didn't work, and what the community really had to say. Next, please. Well, I appreciate you all giving me some time to talk, to getting to know you all. Now we're gonna open it for some questions.
Thank you so much, Andy. I'll pause it by saying we'll take the questions during the question and answer period. So write your questions down and get them together so that we can take them during the question and answer period. I want to pivot and invite my brother Brandon to the stage. Brandon is a dedicated peer educator and advocate with a strong focus on community health and wellness. With lived experience and a passion for outreach, he brings empathy, authenticity, and real world insight into his work, whether connecting with the individuals in shelters and clinics or community spaces. He strives to share accurate information, build trust, and promote harm reduction through meaningful conversation and support. His mission is to educate, empower, and to elevate those often overlooked. With that being said, I want to welcome Brian.
Hello, everyone. I appreciate you for the well welcome. It is a pleasure to be here and talk about my journey with this Mpox and community. So I've been doing this roughly about a year now. And it's been quite a mission, to say the least. Depending on community and where I go, one thing our previous speaker spoke about is some pushback, especially in our urban communities that are unhoused. Questions that often come by, why is this not like really being broadcasted in the media? Is this reach? What's going on? We don't really hear about this. Like, who are you and why are you here? And I'll speak further into that as we go into our slides. But overall, I enjoy what I do, and I'm going to keep on, spreading the word and basically doing whatever I need to do to make this possible and get people on board to getting vaccinated ultimately. Absolutely. So we can go ahead and start moving into our slide. So what is Project Safe Start? That is me. Project Safe Start is a community-centered health initiative that promotes sexual and reproductive well-being for those who need the most. Our mission is to provide accessible, affirming, and culturally responsive services to empower individuals while building healthy communities. So I really get out there to community of all kind and just sound the alarm about anything STI related. Vaccines are one thing I speak about later, because as soon as you say the V word, you start losing interest. Like, okay, are you a vaccine pusher? What's going on? So I would like to kind of like get a feel of the crowd first and speak about their needs and do a knowledge-based questions about what do they know about certain STIs, or have they even heard of Mpox before, or do they know what PrEP and PEP is, and things of that nature. You can go to the next slide. Okay, this is just like a general outline what community looks like for me when I'm on my outing. It's generic AI photos, but pretty much this is what it looks like when I'm in community. You can go to the next slide. Okay, so this is one of the communities that can be quite cumbersome at times. Reaching out to the unhoused communities about Mpox can be challenging. I'm often met with skepticism. Questions like, are you here to push vaccine, or why are you talking to us, are very common. When that happens, I lead with the fact that, how serious Mpox is and how easily it spreads. Once folks understand that it can directly impact them, their interest shifts. They become more willing to talk about it and become more curious, especially when I have like information that has like some of the photos that are quite a bit graphic, that really like opens up the door to building the conversation. That's pretty much my opening to break down myths and share real info and build trust. It's really not about health. It's about respect, and showing up with the purpose of disseminating this information so they all can know and be in the know. You can go to the next slide. MSM groups. Attending MSM groups to speak about Mpox has been a rewarding experience, very much so. Many participants are already well informed about the virus, which creates spaces for meaningful and engaging dialogue. The few MSM groups I've went to, even at the LGBT Center and in San Francisco at the San Francisco AIDS Foundation, speaking with these gentlemen, it has been like a learning experience within itself. Meaningful and engaging dialogue always comes from that, because most of them know about this, and I take this as a learning experience, to ask questions about, when you spoke about this a little earlier, Orlando, about, getting the vaccine and then leaving the mark, and, at the site injection, soreness, from the vaccine, or maybe slight side effects from nausea, it varies from individuals. But, I take this time to jot down everything, and, so I can further know. So when I'm asked these questions, I can disseminate information more accurately. Getting back to the slide, when in these spaces, discussion often begins with shared memories of how hard the Bay Area was impacted during the 2022 outbreak, what we spoke of a little earlier. People quickly sought information and were eager to get vaccinated. I found this, but like all the places I went, San Francisco was really on top of their game when it came to that. The word hit hard in the city, and people were eager to go get in those lines and to learn what was going on and get vaccinated. Let's see here. I use these opportunities not only to educate, but to listen and learn. I asked about their experience with the side effects I just mentioned in vaccinations. Again, the conversations provided valuable insight and has allowed for me for mutual learning that strengthens our community response to Mpox. You can go to the next slide. MSF club settings. So going to town and in other areas here in downtown Oakland. Again, it's not really so much cumbersome, but it's a strategy that I'm still learning as I go out and outreach in these areas. It can be a hit and miss, and it really depends on the individual and the mood and the moment. Starting a conversation about Mpox in the middle of a party scene isn't always easy. My general approach, it varies. It just depends on who I'm looking at, and try to feel the room. And try to speak to the room and the participants that are there or patrons that are there. One thing that does break is an icebreaker. We've came up with these little pouches that contain sex items like condoms, small little sex toys, educational literature, that speaks to PrEP and Mpox, and once the people that are there take a look at this, it kind of breaks the ice, and that can easily allow me to get in to quickly pass along, contact information. So if they became interested, they can contact me, and doing so, it works pretty good, and from that, I was able to get people to sign up for my Mpox workshops and PrEP workshops, and turn people on to PrEP and everything, and getting them actually vaccinated, and then actually, getting the shots, the 2 series shots for PrEP as well. You can go to the next slide. Street outreach and events. So when it comes to street outreach and events, it's mostly about planting the seed by getting materials into people's hands. As you all know, at large events, folks are really moving around, trying to catch everything that's going on. I try not to hold people's time, because it's usually a lot when we are at fairs and events. I really just try to just pass out literature, and a quick contact card information, and that, again, just like the club scene, it's pretty much effective. Street outreach is definitely a different ball game. The key is using flyers with bold visuals and illustrations, like what I spoke of before, like what Mpox really looks like, and it gets the attention to get them to stop and ask, what's this about? The moment opens the doors for a conversation, even if it's just a spark interest for a deeper discussion later, in a safer and more appropriate setting. It's been times, when we were out, and when I display things from the information that I pass out, it creates a big whoa, and then people want to start speaking to their personal things, and sometimes it's not really the proper setting to speak. So I try to keep it minimal as possible, and then just basically just collect their information and then moving forward. As I stated in the slide, it's not always about the full combo right then and there, but it's about creating curiosity and breaking up the stigma, and that leaves them, a way to follow up. So I hit them with a few punchlines to create curiosity, and then when I speak to them at a later time, we can like fully engage. You can go into the next slide. Again, how the community teaches me. Being in a community doesn't just make me a messenger; it makes me a student as well. While I'm out there educating, I'm also learning. The community constantly teaches me how to be a better advocate by showing me the value of listening deeply. And that's one thing I really do. And that's something that I value self when listening to community. Instead of always speaking, when you listen, you learn a lot, and the community has showed me a few things. I've learned to slow down and really hear people's stories, especially from those who've been vaccinated, those who've experienced Mpox firsthand, and those still navigating this impact. In this journey, I've met two people who actually contracted Mpox, and they shared their stories about, how difficult it was and the embarrassment, and then, trying to go see about it, and that's like very important to learn these things. Also ask questions to what are the symptoms like, how did the vaccine affect you? What do you wish others knew? Mpox is spoken of in certain communities, but it's not a huge topic. And when I pretty much ask people about Mpox or monkeypox, I try not to refer to that term, but like Mpox, what is that? Is that the same thing as monkeypox? I'm like, yes, but we just say Mpox now due to the derogatory that follow or the stigma that follows around with monkey and people of color. Like what I kind of heard of it, is it like something that's similar to herpes or things like that? Then I go into the breaking down what it really is. And it was like, well, we don't really hear it on the news much, so why are you here again? It goes back to that conversation. But it's like I said, it's pretty much a hit and miss in different communities. But I always strive to try to change and correct my communication to always be a one that I can reach. But back to the slide, the conversations that teach me more than any manual could. When someone speaks with from lived experience, I pay attention to their knowledge shapes of my own. Each encounter becomes another lesson, another piece that I add to my approach. And I pretty much stated that earlier. So I can connect, inform, and support more effectively. In short, the community doesn't just receive the message, they help me build it. And that's one thing that I always add to my tool set, based on, outreach and speaking to different people. Okay, you can go to the next slide. And this is my final reflections here. As a public servant, I see my role as more than just sharing facts. It's about sounding the alarm. And that's what Michael Benjamin and myself here at CalPEP always, we in the community like sound the alarm. We're messengers to sound the alarm with care and clarity and purpose. When it comes to infectious diseases, especially in underserved communities, I take this responsibility seriously. The work is urgent. The stakes are real. My job is to accurately reflect what's happening on the ground. I listen, observe, and report back, translating community experiences into prevention strategies that actually reach people where they are. And that's one thing, we have some groups out here that talk at people rather than talking to them. As you can see, I'm not the best public speaker. And when I'm in community, I really don't get nervous, but, you have to read the room and then apply, your technique to who you're speaking to. And one thing is, I never want to shame or be the one to point the finger or blame, like, why you're not listening to me? Why are you worried about this incentive rather than just listen to the information I have? Because it's imperative that you know this, because this is something that's really here and it's not going, just like COVID and any other infectious disease that's out here. It's about risk reduction. It's not about judgment. It's not about meeting, it's about meeting people with respect and not ever to assume anything. I try to stay grounded in truth and transparent. One thing about CalPEP, we stand hard and strong about, disseminating information that is accurate, and that's pretty much what I do. And this is how I'm in community, and I appreciate your time.
Kurt, Brian, thank you so much. I think one of the piece that you left me with, and you said that you're not much of a public speaker, but you did amazing.
Thank you.
And there's one little nugget that you left me with as a community researcher, and that is when you work with community, it's not just about delivering the message, but having community help you build that message. And I
Absolutely.
think that's so critical that we are involving community in that process of building and disseminating the message. Because if we build it and create it ourselves, and then we're surprised when folks don't show up,
Absolutely.
right? And so I really appreciate that last bit
Absolutely.
of information from your talk. Next up, we have Mr. Curtis Moore. Curtis has worked in public health for more than 25 years. He worked for the California State Genetic Disease Branch Newborn Screening Program before serving as the executive director of a youth HIV/AIDS nonprofit for 11 years and lectured at several universities and colleges in the Bay Area. Um, Mr. Moore is the current section director, HIV, STD, and HCV for Alameda County Public Health, the Division of Communicable Disease Control and Prevention. He has dedicated his professional life to working with communities to improve our collective health. And of course, one of the main tenets of public health is our duty to warn. And so, with that being said, I would like to invite Mr. Moore to present.
Thank you so much, Orlando, for inviting me to be part of this. And excuse, I have a bit of a cold, so my voice might sound a little weird. So bear with me. So my name is Curtis. I go by he, him pronouns. I work for Alameda County Public Health Department in the Division of Communicable Disease Control and Prevention. Next slide, please. So what is Mpox? I know I might be covering ground of knowledge that others might have, but I feel like it's also important to go over it again. Mpox is a viral disease caused by the Mpox virus, which is related to smallpox. It has symptoms that are similar to a number of other infections. We've actually had providers who confused Mpox pustules with early syphilis as well as herpes. So we know that that could become challenging for a lot of providers when dealing with the potential cases of Mpox. How is it transmitted? It's prolonged contact with an infected person, bodily fluids or contaminated materials like bed sheets, towels, or clothing. Next slide, please. Why are we still talking about Mpox? It is not gone. There are outbreaks in different regions, as Dr. Harris pointed out earlier in his presentation. There are changing patterns. The spread is beyond historically endemic areas, which is a cause for concern, as well as that is combined with some public fatigue, which also contributes to kind of some complacency and concern that decline in some areas, especially in some communities. Next slide, please. So just wanted to give you kind of a snapshot, and this is not the extent of the data. I'll add in the chat a paper that we presented at a conference last year and published in a medical journal. So I'll add that link later on so you can have access to that paper. As it stands this was yesterday. We have about a case every other month. So right now we have a current case that we're investigating. So we know that it's still in our community, it's still circulating in our community, and it's something we have to continue to be vigilant about. In the height of the outbreak back in 2022, we had 242 confirmed Mpox cases in Alameda County. And the highest incident rates were among Black MSM and Latinx MSM community. And on the flip side, the lowest vaccination rates were within those same two communities. So that's also something that we need to kind of put a pin on and keep that in focus. Next slide, please. At-risk populations, communities that are disproportionately affected. The LGBTQ community, LGBTQ communities of color, immunocompromised individuals, healthcare and frontline workers. And the reason I put the healthcare and frontline workers is one of the things that one of the groups that we cannot focus on, but individuals who are dealing with individuals who might have a case of Mpox, they also have to take very high precautions using PPE to prevent themselves contracting Mpox. Next slide, please. So as we mentioned, we had access to the Jynneos vaccine, and this is a recommended treatment. And at this point, I want to give a shout out to a couple of our partners, CDPH, the California Department of Public Health, for helping us access some of those vaccines so that we can distribute them for no cost to the community. The LGBT Center, that was really crucial in providing access to Mpox vaccines in these communities of color that are most affected by Mpox vaccines. Vaccines not commercially available, and that's a fancy way of saying it's access to free vaccines are extremely limited or non-existent in some areas, and now the dependence is on insurance coverage for individuals to be able to access Mpox vaccines, both for PrEP, PEP, as well as Cabrera for treatment. Advice in this situation, this new situation we're in, it's also to kind of avoid close contact with persons that might be suspected for having Mpox. I'll also put a link after I present that we've compiled here in Alameda County of where individuals could access vaccines in Alameda County, but those locations, it's really based on insurance, Medi-Cal, all insurance possible, but not free. So yes, and I just wanted to point out that individuals who are in ADAP, there is a PrEP app that also helps individuals who are immunocompromised because of HIV, so that you can access medical care and the Jynneos vaccine, which is covered for those individuals who are enrolled in that program. Next slide, please. So some lessons learned from previous outbreaks. Early response matters. And what I mean by that, coming from a public health department view, is that this triggers one of emergency response and setting up a team within the public health department to address the outbreak. Focus outreach to communities most affected. It took us a while, and I forgot their first name mentioned from the LGBT Center mentioned Joe, and I just wanted to also kind of lift that up. He was very, very forceful, and Andy, thank you for popping up, so I got the name. Yeah, he was very, very forceful. He reached out to us and basically cussed us out. And as he would attest to, I really appreciated that. Because he was in a position to do that. I within the public health department, I can't cuss my teammates out, but I could strongly suggest, but I was really happy that he did that. And that really triggered kind of the emergent situation, and really was able to work very closely with the LGBT Center to set up those vaccination clinics and Bay PLS, helping us out with nurses and vaccinators, and CDPH providing that support as well. One of the other things, it's really about appropriate and culturally competent communication. We have to figure out as a public health department how to speak the language of the communities that we're focusing on. And that key is really bringing on individuals from those communities as equal partners to really craft those messages and disseminate those messages to those communities. And it's something that we did. We used some of the community advisory boards that were established during COVID. That was really helpful to get those messages. We started something that was called the Gay, Bi, Trans Men Health Roundtable. We were able to pass some of those messages through that group and get their input on how those messages appeared to the community and whether or not they were effective, and were able to make necessary adjustments around that. Good data collection. Within the Public Health Department, we have an epidemiology and surveillance team that collects Mpox data as well as other communicable disease data. And one of the things in the early stages that we met regularly with the EPI team is about how could we design forms that were addressing, the whole person and getting that information and making sure that we had as complete a data set as possible, that we can do more accurate analysis so that we could actually use that data to drive our strategies of implementation, prevention for Mpox. Creating community advisory groups and also using them, I kind of mentioned that earlier, distribution of resources and information gathering on the ground, and really kind of getting those firsthand reports and making sure those individuals are able and feel comfortable enough to provide the information that we need to do some of that analysis. Recognizing the role of social stigma, and this was brought up a couple of times with the previous presenters. And one of the things that's really challenging from the Public Health Department way is that a lot of us know about stigma. We talk about stigma constantly because of our education or because we have heard the term so often, but I'm not convinced that we completely understand what it really means. And it's something that we're constantly working on, and it's really important to get community input to recognize some of those things. And really putting that front and center in any strategy that we design and implement as a public health department. Next slide, please. How can we help? And this is the royal way. We have to stay informed. We have to make sure we have accurate and updated information that we're sharing and distributing. Part of it as a public health department, we're required by law to provide health advisories, health alerts, creating some of those guidance around isolation. And so we have to make sure that we are on top of the accurate and updated information, provide resources to the community, and especially communities most affected, and provide all the support we can. And we say support, and there's one thing that I always say, a lot of people are uncomfortable talking about money. I'm not. We can talk about support, and if we're not putting our money as a public health department where our mouth is, we're not providing true support, because the reality of this is that everything costs money. And so, a commitment to providing that funding. And one of the examples that Andy also pointed out is that there were gift cards that would be provided for individuals as an incentive to come in for vaccines, as well as to come in for their second shots. One of the guidance around individuals and providers: don't ignore new and baffling rashes. Yes, we know that it might look as something else. The only way you can confirm that it is Mpox or not is to seek a medical diagnosis around what it might be. Get tested. And in this situation, I know that a lot of places that test, it's like we advise that you also get full STI panels, although Mpox is not an STI. Classic STI, the reality of it is it's mostly transmitted, with prolonged contact, and that is basically what happens during intimate activity with individuals. If you were exposed to someone who you suspect might have Mpox, contact your healthcare provider and go get tested and get advice for post-exposure treatment if needed. Next slide, please. Some of the takeaways: Mpox is still around, especially in the MSM communities of color. Prevention and awareness is crucial, so we have to keep it front and center and continue to get those messages out. Collecting complete and accurate data is very important. And one of the things, as someone who also have a degree of focusing on epidemiology, is that data could really drive care in all aspects of communicable diseases, and it's something we have to be very vigilant and committed to. Access to testing is important. Access to treatment, as well as medical prevention, is also very important. The other key thing is kind of building those strong relationships with members of the communities most affected. And that should be one of our priorities in dealing with Mpox. Stigma, and there's a little typo there. Stigma and misinformation continue to be huge challenges that must be addressed head on. And we also have to bring up the concern about medical mistrust. That's also something that we cannot ignore. Next slide, please. And with that, I want to thank you, Orlando and Duke, for giving me this opportunity. I'll add those links that I mentioned earlier in the chat so you can have access, one to the article that we did on Mpox vaccine uptake, as well as locations in Alameda County where you can get vaccinated for Mpox.
Thank you, Curtis. I will say to the audience that we're collecting all this information, including the information that Curtis just mentioned. And what we'll do on the back end of this is to make sure that we share all that information to you. So if you registered for this webinar, we have your contact information and we'll send you that added information too as well. I want to move into our next presenter. So we have concentrated mainly in Northern California and primarily in the East Bay, but I want to take folks a little further and I want to take you to the other side of our state, to Southern California. And with that, I'm going to invite in Kenya Parker, who is at the San Diego LGBTQ Center. Kenya Parker has dedicated 15 years to specialize in sexual health and wellness, with a focus on HIV/AIDS prevention and care and treatment for marginalized communities. As the Director of Sexual Health and Wellness at the San Diego LGBTQ Center, she oversees comprehensive testing services, education, and department programs. Her work ensures clients have access to compassionate, sex-positive environment, along with treatment and prevention support, long-term medical care, supplemental services that enhance their quality of life. Kenya's expertise spans health education, trauma-informed care, and community outreach. And with that, I'd love to invite Kenyatta to take the stage.
Perfect. Thank you so much, Orlando. It's a pleasure to be here with all of you. I also want to sort of preface this that I'm also not under the weather still. I had COVID last week, so I'm recovering. I've been popping off and on camera because I'm coughing, and will do my best to not have a coughing fit during my portion. But please excuse me if I have to go on mute and have a little water. So again, my name is Kenyatta Parker. My pronouns are she, her. And as Orlando said, I'm the Director of Sexual Health and Wellness at the San Diego LGBT Community Center. And I also want to be mindful of time. I know there's a Q&A portion, so I'll try to just really cover the important things and move through my presentation quickly. Next slide, please. So just a bit about the center. The San Diego LGBT Center opened in 1971. It was simply an answering machine in a borrowed closet where folks could call in who were in need of support. And it's now expanded to really the second oldest and third largest LGBT center in the country. We have over 80,000 direct service visits every year across 6 locations. So the center has grown tremendously. And this is actually my second time around working at the center. I was here in 2014 and 2017. So being back for this iteration, this version of it, has been really nice to see all of the growth. Next slide, please. The vision of the center is to make every person feel and know that they are welcomed, valued, and supported as a beacon for our regional LGBTQ community. And each day we actively recommit to a more vibrant, bold, innovative, and modern center than the day before. Next slide. And a part of that as well is the commitment to inclusion, equity, and anti-racism. The center wants to create an inclusive, equitable, and safe community within the LGBTQ plus community in San Diego and serve as a model, not only in our region, but for the world as well. Next slide. So the center has many departments, but the Sexual Health and Wellness, or BTG team, which is the team that I help support, is where most of the Mpox work happens. So the Be the Generation started in 2014 at the center and started as a really robust social media and activism campaign to get to zero infections in San Diego County. And since then, it's transformed into this really comprehensive sexual health and wellness program at the center. So we have 5 tenets, they're sort of our beacons, our pillars for how we operate, which are fight, test, treat, protect, and empower. But we offer many services now, including HIV and STI screenings, sexual health education, not only in person with clients, but in the community, treatment support services for folks who are living with HIV or need other treatment services, prevention services, which include PrEP and PEP referrals as needed, as well as referral coordination for anyone who needs services not only within our agency, but outside of our agency as well. Next slide, please. So I wanted to quickly just go over where San Diego County is at with the Mpox. And this is updated pretty frequently. So the last update of this information was as of July 1st. So the county is consistently updating the Mpox data. So during the 2022 regional outbreak, which lasted in San Diego from about mid-June to the end of August, there were 473 cases reported, 18 hospitalizations, but no deaths during that initial outbreak in 2022. You can see as of July 1, that number has increased to 614 cases, 24 hospitalizations, and 1 death since that time. So transmission in San Diego remains low but persistent. So we're still seeing about 1 to 2 cases per month in the county. Next slide. And this is just some of the demographic breakdown. It really sort of matches what we would expect. Mostly in cisgender men, about 98% of the cases in San Diego are reported in cisgender men. Same with sexual orientation. Gay, lesbian, or same gender loving folks are 80% of the cases that we see with an Mpox diagnosis. And then race and ethnicity breakdown. Hispanic or Latino folks are 45% of cases. Followed by white at 39%, Black or African American at 8%. And I'm going to circle back to this when we talk about the disproportionate impact that Mpox has had on communities of color. It's no different than in San Diego as well. So next slide. This next one I just wanted to show, which some folks have already touched on, is sort of the challenge of getting folks to come back and complete the vaccine schedule. So in the county of San Diego, about 18,000 or closer to 19,000 people have received their first shot, but only 12,000 people have received the second dose. So we, like other folks have shared here, have also been struggling to really catch folks again to get them to come back and complete the vaccine. And it unfortunately sort of limits their protection, but we continue to do the work. I didn't include it here, but when we also look at the ethnic and racial breakdowns, we also see that the folks most impacted by Mpox are not the ones receiving the vaccine the most in San Diego County as well. So we continue to work with those groups, those communities who are most impacted and need the most protection. Next slide. So I wanted to touch on specifically the transmission dynamics in San Diego. And this is true not only for Mpox, but for other communicable diseases, HIV, COVID especially. San Diego is situated on the border of Mexico, and the port, San Ysidro, the port of entry, is the busiest land crossing border in the world. So we have over 40 million border crossings every single year. So we can see upwards of 100,000 folks and that's really just in cars crossing every day. That doesn't account for folks on foot who are crossing the border every single day. So that is really an intense, like, routine movement that creates a lot of overlapping contact networks and really kind of a blurred epidemiological line. So when we see impacts in San Diego, we know that that's also impacting our neighbors across the border. So it's just a really dynamic situation where we're constantly, whether it's surveillance, prevention efforts, vaccine efforts, that we have to work closely with our partners across the border to get a handle on not just Mpox, but COVID, HIV, other diseases as well. Being right on the border also creates some additional challenges in that there can be differences in healthcare structure, surveillance capacity, vaccination access. So trying to manage that unevenness and making sure that folks who are covered, because we know people who are crossing the border every day are part of this larger community, whether it be in Mexico or here in San Diego. But there are some existing collaborations in place, including the Office of Binational Border Health. The Border Health Consortium of the Californias have a strong partnership with NGOs here in San Diego, the county, other academic entities. Everyone is working together to make sure that folks here in San Diego and in the United States, as well as our partners across the border, have access to the latest training, vaccine information, information dissemination, because again, because it's such a fluid situation, we know that things that are happening here are also impacting folks across the border. Next slide. So the center's work specifically started in 2022, like it did for many of us. We had a county contract that was really focused on prevention efforts and PrEP navigation, online and in-person outreach. And then in 2022, when the first cases started to be reported, there was an Mpox component added to our already existing contract. So there were 3 funding cycles. As you can see here, our last funding cycle was in the summer of 2024, so about a year ago, but the work still continues, even if we're not being funded for it. As Curtis mentioned, these things cost money. And even if we're not necessarily being funded to do the work, we recognize that it's incredibly important that it continues because it impacts the community that we serve. Next slide. So the center was really one of the earliest thought partners, along with the county and other organizations here in San Diego, about crafting education and messaging around Mpox in 2022. So there was a bunch of folks that came to the table to really decide, how do we address this? How do we talk about this, especially being right in the thick of COVID and having to then deal with another novel disease that people are fearful of and scared. A lot of folks have mentioned the fatigue that folks were feeling. So we were at the table to help figure out how to craft some of that messaging. There were some differing opinions on the best approach to do that. But as the center, our main goal was to always maintain a sex-affirming message when it came to how we talked about Mpox transmission, prevention, and treatment. So the center participated along with the county and other community partners in community town halls. Obviously, during COVID, a lot of those started out as virtual. But we were just informing the community about what was going on, what access to the vaccine looked like, what symptoms look like, where to access treatment. And we also developed some marketing materials using social media and some paid advertisement as well. Next slide. So these are just some examples of the education and marketing that we did, recognizing that Mpox was impacting different communities differently. We wanted to be sure that the marketing really represented and looked like the folks who it was impacting. So you can see some of those examples here. Next slide. Just again, more examples of our social media outreach, our website. We have a landing page still up for Mpox where folks can get information. Next slide, please. We also use social media to really disseminate information. There's a local doctor here with quite a large following. So he partnered with us to create reels and Instagram posts informing folks about what Mpox symptoms look like, where to access testing and prevention. Next slide. We talked about the disproportionate impact. The same is true here in San Diego. So as the data that I showed is that folks who identify as Hispanic or Latino account for 45% of cases, but they're only 30% of the population here in the county. So you can still see that disproportionate impact in San Diego as well. Next slide. And our approach to sort of addressing those gaps is to work closely with our community partners and within the center. We have a Latino services, we have a Black services program. So we really work with them to make sure that our prevention and care is culturally responsive, community centered, and language accessible. Next slide. So there were some challenges, but also lots of successes. Really through our efforts, we saw reduced misinformation and fear through consistent community-centered education, expanded vaccine availability, especially for folks who needed it most. We hosted vaccine clinics at the center in our parking lot during COVID. We still host them now where folks can get the Mpox vaccine, COVID vaccinations, flu shots. So we always try to incorporate those in any outreach events we're doing, routine immunization efforts, increased community awareness. It was just our Pride last week, which I sadly missed because I was at home. But we were continuing to talk about Mpox. Mpox is still here, especially at a time like this when we've had our big Pride Festival. And just the center continues to provide ongoing support for accessible resources and regular vaccine clinics for folks who are interested. And I think that's it for me. And thank you. And hopefully there's still time for a Q&A. Thank you so much.
Thank you, Kenyatta. I will say a ton of information was just thrown at everyone. And I know we only have a few minutes, but and apologies for not leaving enough time for that Q&A. But I do want to just make a couple of quick points. One, I appreciate the support. All of this was organized. All of this stemmed from some of the work that we're doing here at CalCenSyn. But more importantly, we reached out to actually the maker of the vaccine, Bavarian Nordic, to get more information from them for us to relay to our communities. And we appreciate them supporting this effort and making sure that this information gets out to the community. So I want to just thank them for their support. The second thing that I will also do is I've placed in the chat a link to a vaccine locator. We have talked about a number of these different issues around challenges to getting vaccinated, and what you've seen were really efforts from communities to get people vaccinated and how they got folks vaccinated. I did something recently, I did something today, and I wanted just to share this with you guys. So I'm going to go ahead and just share my screen just really quickly. Just to give you this additional information. So if you go on the link, it looks something like this. And then when you go down to this vaccine locator, you can type in your zip code right here in the vaccine locator search box, and it should pop up within a 25-mile radius, places around your local jurisdiction where you can actually access the Mpox vaccine. Some places will have vaccines, some won't. I know for this one particular link I tried, Walgreens, they were able to connect me to a local pharmacy in my neighborhood where I was able to actually find out if they had access and vaccine available, which they did. And so I'll encourage everyone to use the locator, share this link with communities if folks are still interested in getting vaccinated so that they can get access to the vaccine. I think I also want to share that there is on the website a lot of different materials too as well. This QR code that you can also scan that brings you to another site where you can access more Mpox vaccine information. We will try to collate all of these different information and then share them with you guys so you have access to it. I think with that, I want to just before we close out, I do want to just ask the question and more broadly to the panel. We know that Mpox isn't over. There's more cases popping up across the state and across the country. And I'm curious with changes that are happening now and with folks potentially losing health insurance and so on, I could potentially lose health insurance in the coming year or so. What are some of the challenges? And if you can think of one particular challenge that you can think of in folks getting access to Mpox vaccine, and how can communities like your organization step in or the county even where Curtis is, to help to facilitate folks getting vaccinated?
I can answer briefly. As I was listening to everyone and everybody's efforts, I think that something we're considering, and this is considering we haven't really talked about it, is still offering it on our major events. I know Oakland Pride is coming up in September, and although we put our efforts to do HIV, STI testing on site, I think this year we want to do something different where maybe potentially offer the Mpox vaccine if possible during this event, because everybody comes from everywhere, not just within Alameda County. So I think that will be one ask I'll have to do to our directors and also, of course, our CEO, see if we could actually do it again. But I think one of the biggest other concern I personally have is our uninsured folks. We will have a lot of uninsured folks through Medi-Cal as things have been changing. And so that's my biggest concern. Where do we send our uninsured folks? Because I get it, folks who are privileged enough to have insurance can access through primary care or a Walgreens, right? But I'm still, what about our uninsured folks? I still have that big question.
And I couldn't agree with you more, Andy. That's really where my mind went to as well, in terms of folks who don't have insurance and how they can have access or receive access to the vaccine, being that it's now only commercially available. And I think efforts like what you're thinking about at the Oakland LGBTQ centers and other efforts like that will be critical in getting especially our uninsured folks vaccinated. So I really thank you for that and lifting that up in the conversation too as well. I just wanted to add, and I think there was another question that was in the chat that Curtis actually answered, so I won't necessarily go back to it. But the question was, Mpox truly isn't over. Any thoughts on how to integrate Mpox consultation or vaccination with other activities and services such as STI screening, HIV PrEP, DoxyPEP, etc.? And I really appreciate your response to that question too as well, Curtis, because it should be part of the whole screening process. We know that Mpox isn't over. We're in the middle of the summer. People are traveling. A lot of the Mpox cases are also travel related. And so one of the messaging should be, hey, looking to travel over the summer. Mpox isn't over. Get vaccinated. I can see that campaign easily. And I'm remembering in my head that new meme on social media around that Jet 2 holiday. So if you guys can mix that Jet 2 holiday thing and put an Mpox messaging on the other end of that, I think it's an excellent way to get folks vaccinated. I'm really, truly sorry that we weren't able to get some questions in. But if you do have questions, do not hesitate to reach out to us. We will try to get your questions answered and relay that information back. Thank you to my esteemed group of colleagues who joined us today, and every single attendees who hopped on to our webinar this afternoon. Thank you so much, and have a wonderful, wonderful rest of your day.